Be organized. If you are going to start your nursing associate trainee course, it's really important that you are organized if you want to succeed. So the first thing I want you to know is that it's possible to do it, and I'm gonna tell you the most important thing you need to know about your first year as a nursing associate trainee. So in the first year, you're gonna have some academic requirements. You need to remember that you're gonna start working towards your level 5 foundation degree in nursing associate practice, and that is a requirement for the NMC registration. So in the first year, you're gonna do models like anatomy and physiology, you're gonna do basic pharmacology, you're gonna do communication and professional values, study skills and evidence-based practice, and you're gonna see something about health promotion and public health. That is in terms of your academic requirements. Second, you're gonna go on placements, which means you're not gonna stay in your home base forever. So you will rotate through different care settings like hospital wards, community nursing, mental health, GP practices, and so on and so forward. And that is because they want you to gain broad experience in different fields. You are expected to be supervised while you are practicing, and you will do this under registered nurses. Gradually, you're gonna start taking more responsibility, and you're gonna start doing more things. Like, for example, if you haven't done blood tests, you will start doing blood tests, maybe shadowing nurses to do some care plans, clinical assessments, things that you usually don't do as a healthcare assistant in your own practice. Placements are designed to meet the NMC standards of proficiency for nursing associates, which include delivering personal care, washing, dressing, feeding. The second one is monitoring vital signs. So if you haven't done that, this is something you need to do for your first year. The third one is assisting with medication administration. This is only under supervision of a registered nurse. Also, you're going to be supporting wound care and catheter care if you haven't done, and you are going to be doing lots of documenting care accurately. One of the core responsibilities in first year is your work-based learning. So you are going to be employed by the trust if you are working for a hospital or for a GP practice, and you need to do at least 30 hours a week. You are going to have direct patient care tasks that are going to be delegated by registered nurse, things like taking observations, blood pressure, temperature, pulse, assisting with mobility and nutrition, or any basic clinical procedures. This only works in physical health, because when you do mental health, is completely different. In mental health, you are basically be shadowing patients rather than any personal care or physical intervention. You are going to have, I think, if I don't remember wrongly, you are going to have an exam where they're going to assess your anatomy and physiology. Then you are going to have your maths exam where they are going to check your drugs calculation. Then C, you are going to write an assignment, and this is about public health. And then you're going to submit your path. So, and I said you have to be organized because of all the documents you need to have ready, and you are going to be working at the same time. And also, if you have family like I am, I have children, I am married, English is my second language, so it can get a little bit overwhelming. But if you are organized, I'm sure you can do it. So what I do, basically, I'm gonna show you. So this is my notes. So here I'm listed what I have to do and when I have to do it. When is my placements, when are my uni days if I have to go to university physically, and the important dates, for example, for my maths exam, for my ski, which is for second year, my assignment, I have to do also a presentation, and to hand over my part. So I write everything I have to do in a year, so I keep it handy and check it constantly. That's one thing, being organized. The other thing you need to do, so I think nowadays they are doing EPAD, which is an electronic practice assessment document. This is mine. This is for my second year. I did mine as well. It was on paper, but nowadays it's on the computer, which might be a little bit easier for some people, I don't know. But here again, you have to be really organized. What I do is I separate it. I go through this. It took me around 3 hours probably to organize everything, but you have to collect lots of information here. Signatures from your home base, but also from your placements. You have to write interviews, you have to write reflections. I'm gonna see if I can show you very quickly without showing any information. Signatures, so you have to complete all this information about your placement and about your home base and reflections, and you have to do it throughout the year. So what I do is, again, I separate it with this color coded, so I know where people need to sign. This is for my practice manager to sign, for my placement, and for me to sign as well. And also you need to collect patients' feedback. This is for my patients' feedback about your care. So this is one of the really important documents that you have to hand in at the end. Other things for your maths exam, I always have the formula. So this is the formula that I really suggest you have handy, because it will help you with your marks, and also you can practice if you have time. Sometimes when you go on placements, for example, in mental health, you are not allowed to do anything, but sometimes you might have time to study. So I always have this printed so I can study, for example, for maths. Another thing really good to have is this book. I really recommend having it, because this is for adult learners, and again, color coded. It's really easy, especially it helps you for when you are writing your assignment, because you need to, I think, reference 10 books that have you read or the research. You will know what I'm talking about when you are writing your assignment. But I really suggest having this book handy, and again, you can read it, and again, super color separated, with different stickies, so you know where to refer in case you need something specific. But I really recommend this book again for your first year. And the beach training. The beach training is a training that you need to do for your A to E assessment, and that will come very handy in your second year. But again, you're gonna do this in the first year. So just as a recap, in the first year, you're gonna do an exam about anatomy and physiology. You're gonna do math exam, just drug calculations. You're gonna do written assignment. I think it's around 3,000 words. Public health, you have to choose different topics. There was, when I did it, there was obesity, smoking, I think those two topics. Yeah, obesity and smoking. So you have to write about those topics and reference all the reading you have done, all the research you have done. And the path. That's the fourth thing. That's in your first year. First year goes really quickly. I honestly can't believe how quickly it goes, because you're gonna be busy working, studying, and your family. Stay sane, try to drink plenty, try to get rest, try to eat plenty as well, have some exercise, and it will help you to clear your mind to be able to achieve this. But believe me, if I can do it, I'm sure you can do too. So stay there, keep going, and I'm sure at the end of the day you will really be grateful for having completed your first year. I hope you like this video. I hope you find it useful, and if you like it, please remember to subscribe to the channel and give a like. Thanks for watching. See you in my next video.